reset. When effective, this shock allows the heart to restore effective electrical activity. If a life-threatening abnormal heart rhythm is not corrected, all electrical activity in the heart will eventually stop. No electrical activity in the heart is a condition called asystole. Defibrillation will not correct asystole. Even though there is no electrical activity in the heart, you should still give CPR. Another less common life-threatening condition occurs when the heart beats too fast. This rhythm is called ventricular tachycardia, or VTach. In VTach, an abnormal electrical impulse controls the heart, originating in the ventricles instead of in the SA node. This abnormal impulse fires so fast that the heart's chambers do not have time to fill. With little or no blood circulating, there may be no pulse. Defibrillation is the best way to stop VTach as it allows the heart to reset and return to an effective heart rhythm. Although it is rare, children may also experience life-threatening heart rhythms. Defibrillation is also effective in children, but take care to use defibrillators with adapters designed for a child. They deliver a lower energy shock considered more appropriate for children.
Press flashing button.
Automated external defibrillators, also called AEDs, are portable devices that analyze the heart's rhythm and determine if an electric shock is needed to restore an effective rhythm.
Shocking. Stand clear.
An AED can deliver that shock, either automatically or with the push of a button. There are a variety of AEDs in use today. Different models have different features, but all provide the same basic functions. On some models, the pads and cables are pre-connected and attached to the machine. On other models, the pads and cables are pre-connected but must be attached to the machine. Most models have pads featuring instructions or illustrations that show where to place the pads on the victim's chest. Placement instructions on the pads may vary. Pads can be color-coded to indicate which pad goes where on the chest. To turn the machine on, some AEDs have a power switch or button. Others are activated when opening the unit.
Shocking. Stand clear.
Some models will automatically shock the victim if an abnormal rhythm is detected, but most have a button the operator must press to deliver a shock.
Treatment delivered.
Because all AEDs are different, follow the manufacturer's instructions and local protocols to use the unit correctly. Be sure you are familiar with the AED you will use at your facility. An AED is not a replacement for CPR or quick activation of the EMS system. Always give CPR until an AED is available and ready to use. If you arrive on the scene with an AED, use it as soon as you finish your initial assessment and determine there is no movement, breathing, or a pulse. First, turn on the AED.
Call for help now.
The AED will prompt you what to do next.
Apply pads to exposed chest.
The victim's chest must be bare and dry. Wipe off the chest. Remove the pads from their packaging so they're ready to use. Attach the pads to the bare, dry chest. Place one pad on the upper right chest and the other pad on the lower left side. If the connector on your AED is not already plugged in, be sure to connect it only after you attach the pads on the chest. Once the pads are attached and the connector plugged in, make sure no one is touching the victim. Push the Analyze button if necessary. Some AEDs may automatically start analyzing. Let the AED analyze the heart rhythm. For the AED to operate properly, you must not allow yourself or anyone else to touch the victim while the AED is analyzing.
Evaluating heart rhythm. Do not touch patient.
Analyzing. Stand clear.
If necessary, push the button to analyze the rhythm. Repeat instructions and warnings out loud so bystanders do not touch the victim while you are operating the AED.
Stand by. Preparing to shock. Everyone, clear.
Shocking. Stand clear.
Make sure no one is touching the victim, not even you.
Press flashing button. Shock delivered. Evaluating heart rhythm. Start CPR.
After a shock is delivered, or if no shock is indicated, give 5 cycles, about 2 minutes, of CPR before analyzing the heart rhythm again. If at any time you notice an obvious sign of life, stop CPR and monitor the ABCs. Administer emergency oxygen if it's available and you are trained to do so.
AEDs can be used on children as well as adults. Some models come with special pediatric pads that are smaller and designed to be used on children. Other models have a special pediatric key that allows you to attach adult pads to the child's chest the same way as you apply pads to an adult's chest, one on the upper right chest and one on the lower left side. If the child is very small, the pediatric pads may be too big to fit on the chest without touching each other. In this case, attach one pad on the center of the child's chest and the other on the back between the shoulder blades. Remember, if the connector isn't already attached to the AED, plug it in only after you have attached the pads to the child.
Analyzing heart rhythm. Do not touch the patient.
Analyzing, stand clear.
The AED will analyze the child's heart rhythm and give you the same type of prompts as for an adult. Again, it's very important not to let anyone touch the child, including you, when the AED is analyzing or shocking the child.
To review, if an AED is immediately available at the scene, first confirm the victim has no movement, breathing, or a pulse, then turn on the AED and prepare it for use. Wipe the chest and attach the pads. If necessary, plug in the connector.
Evaluating heart rhythm.
Analyzing.
Do not
Stand
touch
clear.
patient.
Make sure that no one is touching the victim and let the AED analyze the rhythm.
Preparing to shock.
Shocking.
If a
Everyone
shock is
clear.
indicated, push the shock button if necessary.
Shock delivered.
After a shock is delivered, or if no shock is indicated, give 5 cycles, about 2 minutes, of CPR before analyzing the heart rhythm again. If at any time you notice an obvious sign of life, stop CPR and monitor the ABCs. Administer emergency oxygen if it's available and you are trained to do so.
In most cases, CPR will already be in progress when an AED arrives on the scene. Continue CPR until the AED is ready to use. Watch how the lifeguards work together. Rescuer 1 continues CPR while Rescuer 2 turns on the AED and wipes the victim's chest dry. Rescuer 1 continues CPR and Rescuer 2 attaches the pads as soon as possible. Make sure no one is touching the victim before the AED analyzes the heart rhythm. If necessary, push the Analyze button to begin analyzing.
Evaluating heart rhythm. Do
Analyzing.
not
Stand
touch
clear.
patient. Everyone clear. Press flashing button.
Shocking. Stand clear.
Shock delivered. Start CPR.
After a shock is delivered, resume CPR. Leave the pads in place when you give compressions. Continue cycles of CPR until the AED is ready to analyze the heart rhythm again. Follow the AED prompts to continue care. If at any time you notice an obvious sign of life, stop CPR and monitor the victim's ABCs. Administer emergency oxygen if it's available and you are trained to do so. Remember that all AEDs operate a little differently. It is important to become familiar with the AED you are most likely to use.
If an AED arrives at the scene when CPR is already in progress for a child, The steps remain the same as for an adult. Continue CPR until the AED is ready to use. Attach the pediatric pads as soon as possible. Follow the prompts given by the AED to analyze and shock the child. To review,
19, 20, 21, 22, 23, 24,
if an AED
25,
becomes
26,
available
27,
when CPR is already in
29,
progress, continue CPR until the AED is ready to use.
1, 2, 3, 4, 5, 6, 7, 8, 9,
Stop
10.
compressions.
Attach the pads as soon as possible.
Make sure no one is touching the victim before the AED analyzes the heart rhythm.
Everyone clear. Press flashing
Shocking.
button.
Stay clear.
Shock delivered.
After a shock is delivered, resume CPR.
2, 3,
Leave the
4,
pads in
5,
place
6,
when you give
7,
compressions.
8, 9, 10,
If at any
11,
time you
12,
notice an obvious sign of
14,
life,
15,
stop CPR and monitor the victim's ABCs.
21, 22,
Administer emergency oxygen if it's available and you are trained to do so.
29, 30.